Hey, it's Dr. Mike here, ready for another case study. This week's case study is talking about dizziness, and so if this is your first time to the channel, please hit like, subscribe. We're going to be going over cases with different neurological findings, different patient symptom presentations, and we're going to discuss how we change the neurological findings and help the symptoms. So this week we're talking about the dizziness for approximately 10 years. He states he went on a long car ride a long time ago, and when he got back, he states he woke up the next day and he had it. He states if he moves his head too quickly, it'll bring it on. If he goes from sitting up to standing up, or if he goes to lay down, any quick movements really kind of bring on this dizziness. He states he's had MRI of his head done, he's had all the vertigo tests done, he's been put in VOG goggles and they couldn't find anything. He's been to an EENT and he's been to PT. Most recently he had an MRI with contrast to check out the vessels of the brain and the neck, and all of that was really good. He states he's had a CT scan done of his head and his entire body, which also came back good. So that's awesome for us because we know that most very serious things have been rolled out now, and that's awesome. But what we still always do with every patient is we do a brainstem reflex. We check all those reflexes in the brainstem. We check all the areas of the brain with all these different neurological testing just to make sure that they are functioning the appropriate way. And then we kind of dive into different balance testings, and then we also do vestibular goggles as well. So my kind of vestibular goggles, what I like to do is I put them in the complete darkness, and I have a room view so I can actually see the patient and me, so we can see like what we're doing, because I like to do things with them in the goggles, see if it brings back anything, so that I can see what we're doing and I can see the reaction to the eyes in the goggles. So so what we did with him was when we put him in the goggles, they were right. He didn't have any kind of nystagmus. His eyes were very stable. They weren't moving at all. So I was like, okay, that's great. So what I did is I proceeded with our exam, and what I have them do is I have them hold their eyes in different end gazes, left, right, up, down, and I do different neck turns, left, right, up, down, and I want to see if any of that brings on an abnormal finding or causes a symptom to come out. So with this guy, in his case, whenever he turned his head to the right and he held it over there for about 10 seconds and then he came back straight, all of a sudden he developed a right beat nystagmus. So all of a sudden, after he held his head to the right and then he come back straight, his eyes were drifting to the left and beating back like this. So right beat nystagmus. And just as you'd suspect, he got dizzy. He got really dizzy, so we waited a little bit, let things calm down. If he grabs onto something and remains really still, it kind of simmers down for him and his symptoms kind of go away. So I was like, okay, that's interesting. So we noted that, and next thing we did was we did some other head turns, and then I had him tilt his head back like this, hold for 10 seconds, and when he came back straight, that gave him that right beat nystagmus as well. So now we got two different directions where he's getting, one, it's bringing on a right beat nystagmus, and then two, it's bringing on his dizzy symptoms. So I directly know that his dizzy symptoms are related with those findings in that situation, if we can bring it back. So what I do is I try to change it. And what I had him do with, in his case, since he had right beat nystagmus, his eyes were drifting to the left, I had him with his eyes closed, and in darkness I had him look to the right and hold his eyes over to the right for about 10 seconds, come back straight, rest, and then I had him do it again, come back straight, rest, then I had him turn his head to the right, hold, come back straight. He reported no dizziness. I was like, sweet, there's one, we know what to do for that guy. And then what I had him do is I had him tilt his head back to see if that fixed that. He came back straight. He said, I still got a little dizzy with that one. I'm like, okay, well, here's what we're gonna do. I'm gonna have you tilt your head back, and while he was holding his head back like this, I had him look to the right with his eyes, and then I had him come back straight and come down like this, and then I had him do it again. Tilt his head back, look right with his eyes, hold it over there for 10 seconds, come back straight, come back like this. And I was like, all right, now let's do it. So I had him tilt his head back, hold his head back there like that, come back straight. He reported no dizziness again. And the best part was that in the goggles, the right beat nystagmus was actually gone with that too. So I was like, sweet. So that's what we ended up doing to change his findings. Let's kind of dig in a little deeper about why and my thought process behind changing those findings. So whenever you're looking at, so we'll use red for increased firing of certain areas, and then we'll use blue for decreased firing. So what we're going to do is we're going to discuss the right beat nystagmus. So with the right beat nystagmus, eyes are drifting left. So if the eyes are drifting left, we know that the muscles that make the eyes drift to the left are firing too much. So we know that the muscles that make the eyes go to the left and the areas of the brain that control that movement are firing a little bit too much. So what we're really discussing here is we're discussing how the neck plays in with the vestibular system, how the eyes play in with the vestibular system, then obviously how the vestibular system plays in with the vestibular system, because all three of those can cause the eyes to drift in a certain direction. So the first one we're looking at is if the eyes are drifting to the left, we're like, okay, we know that the area of the brain that controls the eyes going to the left is increased firing. Cool. So what we also know is that the right horizontal canal is also increased firing, because we know if we stimulate that right horizontal canal, it's going to force the eyes to drift to the left. Okay. The next thing that we know is that whenever the research they did was they have people's heads stable, and they rotate the body underneath the head, and they see in darkness which way the eyes kind of rotate. So we know that with the neck, if we turn the neck to the right or turn the body to the left, it's going to force those eyes to drift to the left. So now we're looking at any neck muscles that turn the head to the right. Those guys are increased firing. So now we have those three different possibilities that we can use as therapy. So we know those three are increased firing. So what we're going to do is we're going to try to do the opposite area that would actually counteract that. So, or the antagonistic, right? So our options are, let's get to the blue. Our options are we can turn the head to the left, which is going to increase the firing of the neck muscles that force the eyes to the right. Okay, that's one option. Another option is we can have them with their eyes, we can have them look to the right and increase the rate of firing of those areas. Okay. And then our last option is you can turn the head to the right at a rapid pace to get the vestibular system, but whenever you turn the neck, you're kind of getting that guy also. So, other option is we increase the rate of firing of the left vestibular system. And we know that passive movements of the head have a greater effect on the vestibular system, and actually you want to go at a pretty fast speed in order to really get to that vestibular system. So, these are our options. I always look at the weaker areas and how we're going to increase the firing of those. I don't really mess too much with the ones that are firing too much. Besides, I want to kind of simmer those down, and the best way to do that is work the opposite, okay? So in this person's case, the one we needed to address is that he has a right beat nystagmus. So eyes are drifting to the left and they're beating to the right. So the first one I tried was I had him look to the right with his eyes, and I had him hold him over there for 10 seconds, come back straight, rest, looked over again for 10 seconds, come back, rest. I was like, that's awesome. Now let's have you turn your head to the right and hold it there and then come back straight. I wanted to see, did that nystagmus stop? Did it improve? And how were his symptoms? In that case, all of those improved. So I was like, sweet, I know that therapy is going to work well for him. We just got to now do it repetitively and teach him how to do it at home repetitively. The next thing was whenever he tilted his head back, his eyes were drifting His eyes were drifting to the left again whenever he came back straight. So what we did was had him tilt his head back, and we wanted to cancel the left drift of the eyes. So in his case, I had him look to the right while his head was tilted back like this, and hold it over there, and then come back straight. And then we did it again. And after a couple of reps of that, I had him once again tilt his head back, hold it, come back straight. And in his case, that nystagmus was gone, and he also didn't get the dizzy symptoms. So what I do now is we do repetitions of that, and we continue to do repetitions of that, and then I teach him how to do it at home so that he can alleviate his dizziness symptoms. So that's what we did. This is my thought process behind it. In this patient's case, it worked very well for him to alleviate his dizziness. And if you think this case would help somebody, please share it with them. And if you have anything that you've done to fix any of these things, please comment below and kind of tell me what you did. I'm always willing to learn and improve my skills to be able to help other patients. So without further ado, please like, subscribe, all that good stuff, and Dr. Mike is out.